Hello everyone. So from today onwards, we are going to start a series of cases of rheumatism that we have treated in our OPD and clinics. It is a very painful condition, and if we can help the patient to treat these conditions, it is very satisfying for us. So we are going to look for one of the case of rheumatism. This is a case of, we will discuss case and a medicine in short. So this is a case of a 48 years old female patient. She was referred to me by one of my students. So she had this swelling on finger joints and lot of pain, and she was having pain also in shoulders. So as we usually do in our cases, we ask since when these complaints have started to you. So they had started 2 years back. So we inquired about whether any stress she had these 2 years before. So she said ki doctor, my daughter was pregnant 5 years before, and after her marriage she was pregnant. Nearly after 7-8 years she was pregnant, and she got aborted in 7th month. And since then I had started to have this stress about my daughter, when she will get pregnant, how her life will go. Then she again got pregnant just this 2 years before, 2.5 years before. That time these complaints have all increased. She said similar thoughts started to come, whether my daughter will get aborted again, whether she will have any problem, she would have any trouble, because she had done IUI. So whether her health will be okay. And so I asked her whether this is just related to your daughter, and she said initially it was related to my daughter when she was pregnant, but later on it started for nearly everyone in the house. What will happen? What will happen to them? Anything bad is going to happen. So whoever goes outside of the house also, I start to feel anything bad is going to happen to them. And since then this swelling of joints started to come, and from then onwards there is also one thought ki now this is rheumatoid arthritis. It is an incurable disease, and I may not get cured now. So since then I am also being very sad ki I will not get cured from this disease, and bad thing is going to happen. So naturally my next question was whether now her daughter is okay. She said now she is in very good health, but still I have this thinking ki something bad is going to happen with her. Not just her, her family, my family. Something disastrous is going to happen. And this was her main symptom. So here I took the rubric elements from anticipation. And another very important symptom I find here, which is given in bogus synoptic key, which was taught by Dr. Shoaib Khan in one of his webinars. It was fear of misery, fear of disaster, despondent and discouraged. So these two symptoms I took here. Then further on inquiry, she was a 48 years old female patient. So I asked her any other complaints or generals I inquired. So she was having a very sour odor of perspiration, particularly in the vertex area. And she said, doctor, it is only during sleep that I have this perspiration. Throughout the day, I do not have any perspiration. And only during sleep, I have this perspiration which is at the vertex area, and it is having very sour odor. So this was another important characteristic that I got. Then I asked her about sleep conditions. So she was very sleepless, particularly after 3 a.m. in the morning. She said ki, doctor, whenever I sleep, I can sleep till only 3 a.m. I'm not able to sleep ahead of that. 3 a.m. I wake up and these all thoughts start coming in my mind. So this was another very important characteristic that I took. She is sleepless after 3 a.m. and she was very chilly patient. She was in her menopausal age. Her menses were just about to go. They were irregular, and still she could not tolerate any cold air. Generally in menopause, you have hot flushes, you have hot perspirations, but here she was very chilly and she used to feel the slightest cold air coming on her. Then I looked at her. She was fair, fat and flabby in constitution. So considering all these symptoms, elements from anticipation, fear, misery, fear, disaster, and despondent and discouraged about her disease specifically, and then the perspiration, which Dr. Nash has explained, it is one of the key features of calcarea cough. When you are a patient, you get perspiration, which is having particularly during sleep, and it is of sour order. Dr. Nash says it is one of the keynote or guiding symptoms of calcarea cough. So she was having that, and her sleeplessness after 3 a.m. forming totality and described this lady calcarea cough in LM potency, in QDS and frequent repetitions. And gradually, slowly, her swelling of joints reduced. After 1 month, her swelling of joints were completely reduced, and after 3 months, her nearly every pain was gone, her swelling was gone. So she was very happy. Within 3 months, there was no pain, and the main that thought process was there. Whether she was thinking something bad is going to happen, she was anticipating about bad things, were reduced in the first 15 days itself. So this is how we can help our cases of rheumatism and arthritis. Okay, thank you.